VALOR trial has been further updated with continued follow-up of the patients, and we will be presenting updated data as well as some more post-hoc analysis on the outcomes of particularly the patients over the age of 60. And the analysis indicates that with further follow-up, with continued follow-up, the improved survival using Vosaroxin plus cytarabine as compared to cytarabine alone is advantageous, again, for the older patient population over the age of 60.
Okay, maybe a little background to these subgroups.
The outcome of patients with relapsed and refractory AML is very poor. Historically, particularly patients over the age of 60 do very poorly if they don't achieve a complete remission after 1 or 2 cycles of initial induction chemotherapy, or if they relapse after having achieved a prior remission. The VALOR trial is investigating a new agent called Vosaroxin, which is a first-in-class anti-cancer quinolone derivative. And this agent has been shown in preclinical as well as earlier phase 1 and 2 studies to be an active agent in AML. It is a topoisomerase II inhibitor, and it is interesting because it evades common mechanisms of leukemic cell resistance, such as P-glycoprotein-based mechanisms, as well as P53 pathway mechanisms. And it also is interesting because, unlike most other anthracyclines and topo-2 inhibitors, the studies so far have suggested that it has no off-target toxicity such as cardiac toxicity. So the VALOR multinational randomized trial was conducted to see if the addition of Vosaroxin to standard high-dose cytarabine in patients with relapse and refractory AML would provide an advantage both in terms of response, but as a primary endpoint in terms of overall survival. The primary analysis was presented at ASH 2 years ago as a late-breaking abstract, and for the overall population of 711 patients enrolled, there was no statistically significant benefit if you use the unstratified p-value, which was 0.06. However, there was a pre-specified analysis based on age above and below 60, and in that analysis, patients over the age of 60, which accounted for 2/3 of the enrolled population, or 450 patients, did have a significant benefit from the addition of Vosaroxin. Now, the follow-up study that will be presented is with about 40 months of follow-up, median 40 months of follow-up, to see if the advantage was stable and continued with further follow-up. And just to make it short, this further analysis and the further other post-hoc analysis do suggest that the addition of Vosaroxin is stably beneficial, and the benefit continues with the longer follow-up.